Our guests today, Tina Stasiewski and Lori DeCato. We're talking about RAM. We talked about RAM before, and it's coming up, as we record this, it will be coming up this weekend. And so, Lori, you kind of explained what it was before. Do you want to do that again?
Sure. So the Remote Area Medical Clinic is a free clinic that's coming to the Ashtabula Town Square in the old Dillard's location. It's the same space that we occupied last year from April 5th through April 7th. On Friday and Saturday, the hours are 6 a.m. to 6 p.m. On Sunday, 6 a.m. to 3 p.m. So their primary services that we offer are vision and dental. In the dental area, you can have fillings, extractions, and cleanings. In vision, you can get a full vision exam, and if you need corrective lenses, they can make them for you right there on site. We don't do bifocals there, and we don't do contact lenses, but we will make glasses for you, and that does take about an hour, so be prepared for that. In the medical area, we have our primary care providers, we have women's health, we have chiropractic. They've expanded their offerings this year to include acupuncture. We have physical therapy on all 3 days. There will be hearing screening this year, which is a new service as well. There's podiatry that will be there, and we are partnering with some of the local medical schools to include Kent State University in Ashtabula, who will have their nursing students, their physical therapy assisting students, and occupational therapy assisting students volunteering. Kent State Podiatry School from Cleveland will have students there. Case Western will have their physician assistant students, some of their oral surgeons, and their dental students. Ohio State University will have some of their optometry students. Am I missing anything, Tina?
Canisius, Penn State Behrend, and Purdue.
Wow.
Are all bringing students.
And you were talking before that health immunizations will be done there.
Right. So the Ashtabula City Health Department will be on site doing immunizations. And right now there's a hepatitis A outbreak, so they will be there providing that service for any individuals that may need that.
Well, that comes in handy. And the stressing is that this is all free. I mean, I was there last year. I saw it. There are no gimmicks, like I mentioned last time. They're not going to try to sell you a timeshare or anything like that. So it's a pretty remarkable thing. And so what happens is people, they're encouraged to come overnight, sit in their cars maybe. There's a system to it, right? And then they get a number. They will get their turn. Nobody's going to cut in front of them or anything like that. Last year, there were fewer people the first day than they thought. I don't know why people didn't know about it, but so the first night people were lucky. They got in. They could just walk in at 6 o'clock or whatever, get the services. There's a lot more publicity about it this time, so you're taking your chances this time, trying to just walk in at 6 o'clock in the morning.
Yeah, I would get there as early as you can. 9 a.m., 10 a.m. will probably still be fine. I personally wouldn't encourage anyone to wait until 2 or 3 in the afternoon, just because some of those services do take a little bit longer. As Dr. DeCato said, it's an hour for a pair of eyeglasses to be completed. So that last exam really needs to be done by 5 if you're somebody who needs eyeglasses made for you. So the earlier the better.
Right.
Really, to come in. I'd like to add one of the other new exciting things that are coming to our RAM clinic this year is actually a veterinary component. So
I was going to ask about that.
Yes, we will not have veterinarians on site that are providing services to animals, and you still have to be somebody who's coming to the RAM clinic to receive human healthcare services. But there will be an information and resource table where vouchers will be provided for spaying and neutering and some vaccinations of pets. RAM recognizes that there's a pretty strong connection between pets and health.
Right.
So if we can help you keep your pet healthy, that helps you also.
Is this something that's normal with RAM?
They do it in several of their clinics, yes.
Because I was at one of the post meetings and that was brought up, and I thought it was a good idea.
Yeah. It's just need to reiterate, do not bring your dog or cat with you. It's a voucher for you to use at another time.
I also wanted to talk a little bit about the volunteers, and from what there was going to be one elsewhere in Ohio, and what I was told was that they just couldn't find enough volunteers to help. This is a huge volunteer need to get this done. And it's not just optometrists or dentists or podiatrists or medical doctors or nurses or anything, but it's people to sit down and fill this form out. Oh, you want to do this? Go over here, and that sort of thing. Or volunteers that provide food and lodging for all of the medical personnel. I mean, this is a huge undertaking.
Right. It was over 700 volunteers last year. Not everyone is there the entire weekend, which is why it is so many individuals that it takes to pull this off. We are very blessed in this county to have people from a volunteer perspective as well as from a sponsor perspective, whether it's in-kind donations, you mentioned, discounted rooms, free rooms for the RAM volunteers to stay in, or the restaurants and the individuals who provide donations for the food to feed the volunteers. It is an overwhelming response to the support that this clinic has received from our community members, and I'm exceptionally grateful for that.
Yeah, it's could be a huge organizational undertaking, I would think. I think I wake up in the middle of the night saying, do we have lunch Saturday? I don't know if I were in charge.
JP Ducro is really the person who made all of those initial phone calls. That was one of his projects last year in pulling this off, and I don't think anybody ever told him no.
Yeah, what I heard was the opposite a little bit, is that somebody kind of yelled at him because, why didn't you call us? We would have provided some food, that sort of thing.
Yes.
And he did say that I think he bought one pizza out of his pocket just because he didn't want to ask anymore, and there was, this was it. This was the end of the. So he said, I'll just, throw down $10 and take the pizza.
Yeah. Right. This community is amazingly generous. Every time we ask, we have an overwhelming response. So we can't say thank you enough to Ashtabula County, because really we couldn't do this without everyone's support.
And so we talked last week about there's new legislation which will allow for professionals from outside of Ohio that can come in. Last year we had people from Pennsylvania coming in to get the treatment, but their doctors could not come in and treat them without paying a huge one-time fee.
Right. We had a few dentists from New York State that wanted to volunteer that weren't able to. I didn't check the volunteer list to see if they were on this year, but they would have been able to thanks to the efforts of Representative Patterson and his co-sponsor, Representative LaTourette.
Oh, really? Okay.
Sarah LaTourette.
Sarah, that's right, that's right. Okay, okay. Who's from Ashtabula County?
And we'll brag on this a little bit. It's one of the only pieces of legislation that passed both houses of the Ohio State Legislature with unanimous votes.
Wow.
Yes. That's how impactful it is for this entire state.
And from from what I heard is that there was a problem last year with getting enough of certain professionals, just because there aren't enough. There was one of the meetings they were talking about, why don't we have more optometrists? So somebody, while we were at this meeting, gets on his phone and says, well, there just aren't that many optometrists around here.
Right, which is why that legislation is very beneficial
Right.
for us and for any of the clinics that will come in the future in the state of Ohio.
Because although Ashtabula County had the first one, it's going to have the second one, then hopefully some other counties are going to look at Ashtabula County and see how it's done.
Yes, Youngstown in September and Dayton in November.
Okay.
Those are the ones we know of so far.
Okay. And so some people are going to be spending maybe part of their couple of hours of their day here. They can, and if there is time, they can go from one thing to another thing. Basically, was it medical and something else? Is that correct?
Right. So the biggest demand items are vision and dental. So we're asking the individuals to select one of those, and then plus medical. So they can get two services, but we don't have enough time or providers typically to do dental and vision for the same individual. Now last year on Friday, because our numbers were low, some individuals were able to get all three services. We cannot guarantee that. It is a supply and demand.
Right.
It's first come, first serve. So, I would say show up early, because at some point we will be having to stop services in some areas when we've maxed out those tickets.
But you can come back, say if you come on Saturday and you're able to see dental and medical, you're
can go
more
the
than
next-
welcome to come back on Sunday to do the vision component. And I remember seeing quite, probably 10 to 12 people that just the faces I recognized on more than one day.
Yeah, they saw that it went well and they wanted to come back and get. Now, my little story is on Friday, things were a little bit at the beginning weren't that busy, and I asked a chiropractor how's things going, and he says, I won't answer you unless I can give you an adjustment.
So you were in the right place at the right
Yeah,
time.
I guess so. Now, what about women's health? Are there things like breast examinations or anything like that, or?
Do you want to talk to them?
We definitely are offering pap smears again.
Okay.
I would imagine that when they're in the exam room, I don't know if we had anyone honestly who took advantage of a breast exam, but I can't imagine our providers would say no. But definitely doing pap smears again.
Okay. And you're a podiatrist, so did you, Lori DeCato, did you see a lot of patients?
We did actually. So some patients came in because they might just need their toenails trimmed because they can't reach their foot or they had a painful ingrown toenail,
Yeah.
so we did a minor surgical procedure. We had patients that were newly diagnosed with diabetes and wanted a foot exam and just some information on appropriate diabetic foot care. We had some athletes that came in because they had gotten injured in a sport and their parents brought them in to be evaluated. We had some patients that we diagnosed with peripheral vascular disease that they were unaware of. They had neuropathy, so it's amazing.
Oh, well, you learn a lot from the foot. I mean,
yeah.
You probably know better than I do.
Yeah, we were busy. And that was the reason we thought to reach out to Kent State School of Podiatry because these students need to see this.
Yeah.
Yeah, it's a great experience, great learning experience for them.
And there's all kinds of equipment that RAM brings in, right? Like dental chairs and,
Yes.
and that sort of thing.
Yes, it is a fully contained clinic with what they bring with them.
Mm-hmm.
One of the other areas that we have is a resource and information area. So there will be local social service agencies that will set up information tables. Community counseling, Signature Health, Community Action. ACMC will have a table there with information about medical services. There will also be information about further follow-up free and reduced care. So anybody who comes through the RAM clinic and receives services, as they exit, they will have an opportunity to visit with all of those exhibitors.
Yeah. We do have a new partnership this year, too, with the VA Medical Center.
Oh, that's good.
Right. So there's some new legislation that President Trump passed for easier access for the veterans to use local providers if the closest VA location is a certain distance, either mileage or timed. So both the Erie VA will be sending some representatives for the resource table as well as the local VA office here in Ashtabula. So we're really excited to offer that. We did receive a grant from the American Legion this year for our clinic, and it was because we did serve a lot of veterans last year. So it's really exciting.
Ashtabula, and we're almost out of time, but Ashtabula County certainly has a need. Yesterday I saw a report came out that Ashtabula County is 69th as far as health of the 88 counties. So there's definitely a need here.
Absolutely.
Yes.
So the RAM Clinic, it is the 5th through the 7th of April, and it's at the Ashtabula Town Square. And it is absolutely free to anybody. It doesn't matter what your insurance is. If you just want to go there and get all of your work done in one day, you can do that.
Yes, you can.
Yeah.
All right. Tina Stasiewski and Lori DeCato, thank you very much.
Thank you.
Thank you.